I'm going to welcome Elliot Cohen to the stage. We're going to have a conversation about the ways in which we can deploy the new models and the advancement of psychedelic therapy. Elliot, come on up. I think I'll take this side. I know I told you I wasn't, but let's keep it fresh. Keep it fresh. So it's going to be kind of an informal discussion, but I had to bring some notes up here for some numeracy around what's been going on in the industry, because there's a lot of things happening in the space that you've been working in. How about we just start with kind of your origin story? So you're growing up and coming into PillPack. I didn't note this. Elliot's the founder of PillPack, that was ultimately purchased by Amazon and created a totally unique and really groundbreaking distribution model for access. So it has a lot of great ideas and insight about access in the applied medicine model. But what's your coming up into that? Like, how do you become the man who redefines how we get our drugs?
There's
lots of ways to
That's
get
a big
this.
label. First, thank you guys. I'd like to thank Kevin and thank the rest of the Horizons team. I really appreciate being here. And thank you guys all for wanting to listen. It's extremely flattering. I grew up in Northern California. My mom was running a group of community clinics when I was growing up. So I've been surrounded by discussions around health access my entire life. About the time I went off to college, she became the head program officer for a large foundation in California called the California Endowment. I thought this was very normal at the time, but I realized later that not everyone has that level of conversation at the dinner table around who pays for what and why they pay for it in healthcare. So I grew up around that. The other half of the story for me is in high school, my dad, who thankfully is still with us, started having all the normal things that happen to a human as they age. The difference, he had them all happen to him. And so I just got to see a number of different stories through his eyes. And it really, for me, it was this nice blend of understanding in a more systemic way, how are we currently investing as a society in healthcare and creating access? And then what does that actually feel like to be a consumer or patient in healthcare?
So we got to have a little conversation before this. I like the part of the story where you talked about, and many folks in this room are entrepreneurs, like identifying the problem. And a lot of times we make assumptions about like, oh, we need to fix this, or there's this big problem here. We saw like a lot of problems in our rollout up there, but like I liked your key moment of identifying like, oh, this is an unsexy issue, but could be a big solution.
I was at home. I was in business school at the time, and I was at home visiting my parents, and I was interviewing my dad about his experiences in healthcare. And at the time, he had a pretty rare form of cancer that he had initially gotten diagnosed, and they had told him that he shouldn't treat it. It wasn't treatable. He had 6 months to live, and he should just enjoy his last 6 months. He went and got a second opinion. I didn't learn any of this out at the time, but my parents had to get a second mortgage on the house because insurance initially wouldn't pay for it. And they got a second opinion, and the second opinion, ironically, was like the perfect polar opposite. It was don't treat it, but it's such not a big deal. You might die with this disease, but you will not die because of this disease. And so I was sure it was gonna be around that. Like, that's pretty stressful. You know, you gotta leave home for 6 months, go move somewhere else. He had to take a big leave of absence from his job. You gotta take a second mortgage on your house. I mean, these are big things. And I asked him what his worst experience was in healthcare, and he said, I know what it was. It's this damn mail-order pharmacy in Texas. You know? I had this one version of gabapentin, and it was really small, and it was easy to swallow, and they made me give this different version of gabapentin, and it was huge, and it was coated in this weird powder, and I couldn't swallow it, and it was awful. And he went on for 20 minutes about this experience. I was stunned. It really left a mark, and for me, it was what gave me conviction to join TJ, my co-founder, in founding PillPack. It really brought home that for a consumer, it's all of these small touch points. I think we oftentimes in medicine, we get really wrapped a bit around the axle, around the sort of big innovations, and we actually miss all the details that are necessary to make sure that those experiences ultimately get delivered to the consumer in the right way. And honestly, I think it creates a paternalism in our healthcare system that I find pretty insulting. And I think if we all really deeply engage with what it felt like to be patients in the system, we would end up focusing a lot on these key details around delivery.
Yeah, so many micro moments in that. it was interesting when you told me that story the first time. The second opinion feels like the obvious big moment, but it's the like, what's with these pills? What's the situation? The piece around why you care about psychedelics, though, I mean, that's a big leap from going to like your dad and scaling this gigantic company and transforming healthcare to like, why come over here? I mean, we're happy to have you. Welcome. It's really lovely, but why us?
Yeah,
why this part?
Well, California is a good environment, I think, to be exposed to psychedelics at a young age. And I think probably like many people in the room, I had my own personal experiences when I was growing up. And I don't think I would have used the word therapeutic at the time, but they were very transformational for me. And even in the moment, I knew they were very transformational. They really helped me just zoom out and, you know, the sort of colloquial way to say this, just sort of appreciate the forest for the trees. And I didn't think too much about them after that. You know, they had been this really transformational experience for me. And then I saw the phase 3 results come out from Lycos, what was MAPS at the time, and they were amazing. I was like, man, I've been reading papers like this my whole life, and these results seem pretty darn transformational. And my wife's a doctor, and normally, pretty much every single friend that I have is a doctor. I don't know how I ended up doing that, but I am not a doctor, but I surrounded myself with medicine. And I started sending the paper around. And normally when I see a paper and I start sending it around, inevitably, at least 70 to 80% of the physicians that I send it to end up saying something pretty cynical about it.
Right.
And this was the first time that I'd ever sent this paper around, and every single person without fail was like, yeah, no, that's a really interesting paper. Like, you know.
There might be something here.
There might be some here. Yeah, like, you know, and I kept poking, like, well, what might we be missing? And, you know, there wasn't a lot of feedback, a lot of critical feedback. And so that got me much more intrigued. I had a unique opportunity right after that to invest in one of Lycos' early rounds, and so that just pulled me in deeper. And then Imran, actually, at Berkeley, I'd been an undergrad at Berkeley, and I'd studied cognitive science there, and he helped organize a dinner for me with a bunch of who had been professors of mine when I was in school. And I'm a nerd, if that's not obvious, I'm a real deep nerd. So I got to go like hang out with all these professors. I thought that was the coolest thing in the world. And it just further sunk in, like, I think this is a pretty transformational moment. And so I was coming out of Amazon at the time. We'd sold PillPack to Amazon, and I was sort of poking my head up and starting to think about where I wanted to spend my time. And psychedelics was just right at the top of the list. And for me, it's probably more about making a meaningful impact in mental health. I just think that when you take a set of disease states that we've been very poor at treating historically, and you get a new intervention, it doesn't have to be a drug. There are lots of types of interventions. When you get a new, very scalable intervention, you see a field shift in dramatic ways. You think about like heart disease pre-statins versus post-statins. Yeah. These are transformational moments, and I think we're in one of those.
So we kind of hopped over the like PillPack just as a concept. We didn't really talk about what you did there, how you did it, and how it correlates to regulatory advancements. So do you maybe just want to describe for the folks what PillPack actually did and how that's informing the way that you're seeing the role of psychedelia?
PillPack's an average retail pharmacy. So from a business model perspective, we didn't do anything creative, and that was on purpose, actually. What we did that's innovative is we put pills in little packets based on the time and day, so that instead of having to fill a pill box, you just get this roll of packets and they just come to you. And really, in the end, the packets were probably 10 or 20% of the value. It was all of the service work that went into actually being able to deliver those packets that was valuable. And a lot of people, for years, people had said, oh my God, that's so amazing. How did you guys invent these robotics? Like, how did you invent these packets? And you know, we were using machines that were invented in the 50s and 60s that had not been meaningfully updated since then. You could buy them off the shelf. They came mostly from Japan and Korea. And people have been trying to bring these things into the US for 50 or 60 years, and they had just never really worked. And my personal belief in hindsight is the reason why is we have a really complicated medical system. And it's really difficult to coordinate between a disparate set of physicians and a disparate set of insurance companies and weave all that together into a great consumer experience. Yeah. And so most of what we ended up actually innovating at PillPack was the boring pickaxe and shovel, the blocking and tackling work of coordinating with your insurance company and your doctors to make sure that all of the prescriptions showed up at PillPack at the exact right moment in time so that we could turn that into putting pills in packets. But the actual logistics of the pills in packets was the really easy part. It was all the service touch points around it that turned out to be hard.
Yeah, I mean, Dan this morning, I don't know if you were here at the very beginning, but he walked through a large part of that. And I didn't really realize how many arms and hands and, pieces of paper were going back and forth and payments to fund systems. Like, it is not as straightforward as just a pill in a pack.
You could possibly come up with this system if you tried.
Appreciating. But you're doing, or you have done, this is why I brought this up, so the advocacy level. So we're really kind of looking at the difference between statewide and local advocacy work versus the FDA route when we're talking about the advancement of psychedelic practice. I'm just going to read some numbers because, again, thanks to Psychedelic Alpha and our friends over there for always keeping these things up to date. But currently, 23 local level reforms on the go in the states, 9 states with active legislation, 7 working groups at the state level, those are different states altogether, 2 with legislation and regulation that's already been brought forward, 12 with inactive or failed legislations. All that sounded really great, but then, there's some states that are, a bit like my mom, they're not so sure. And then, and then there's been some funding that went and came back, like the stuff that's gone on in Kentucky with Ibogaine. So do you want to talk a little bit about your involvement in that space and the ways that you're thinking about that right now?
Yeah, it was luck, honestly. I had spent the last decade or so in Boston. That's where we built PillPack, and some colleagues from the startup or tech community there had heard that I was interested in psychedelics, and so they reached out. And they ended up introducing me to Graham and a bunch of the folks at PSFC at the MAPS conference last June. And they had actually done some funding to sort of understand more about the receptivity in Massachusetts, and the numbers have come back really positively. And so they asked if I was interested in working with them to support an effort in Massachusetts to get it on a state ballot. And I said, absolutely, I would love to do that. I feel a connection to Massachusetts. I lived there for a very long time. Yeah. I think it's a really fascinating state because it is, it's the root of most folks' medical education in the country. It's some absolutely absurd number, like 50% of all doctors at some point trained somewhere in the greater Boston area.
Really?
Yeah, it's like this unbelievable.
That's why you have so many medical
That's why
friends.
all the friends,
I just solved the big mystery. We're done.
And similarly, I guess I did the same thing I did with the paper. I started emailing and texting a bunch of friends. I have some friends who are really involved in addiction medicine. I have some friends who are involved in advocacy work around decriminalization for drugs broadly, and started asking their thoughts on this. And people weren't universally ready to make it the main thing that they wanted to advocate for. Right. But similar to the paper, there was very little what I perceived to be real critiques. I think the safety, the belief in that population is that the safety profile is really truly quite safe. To Graham's point from the last panel, it doesn't mean there won't be problems, and we should talk about those problems publicly. That is the best way for us as a community to make sure that we're realistic about that stuff and that the rest of the public out there is realistic about it as well. So I don't think we go into this with an overly rosy picture, but on balance, these are pretty safe compounds in many ways. And I think people will benefit if they get out there. And so I've gotten really passionate about supporting this issue specifically in Massachusetts, partly because of a personal connection to the community there. I think more broadly, I think this is a little bit the question you're getting at, sort of like, why not just have everything go through the FDA? That's how drugs get approved in the country. Yeah. Why don't we do that? And I think you could say, there's a community of folks I know that feel the exact opposite, right? It's like this FDA stuff is making this really complicated, and now these drugs are going to be super, super expensive. And why are we doing that? These are sacred medicines that have been around for many, many millennia. They don't need the formality of the FDA. I think there's both of these camps. I have probably an unexciting point of view here. I don't think these things are nearly at odds.
It's binary. They're not. No.
I think they are basically, if you think of them as products, I don't mean the actual medicine, but if you just think of the overall experiences that these pathways enable for a consumer, these are just different pathways, and they just enable totally different experiences. There's no, the amount of money that goes into Medicare and Medicaid is extraordinarily substantial. Almost 50 cents of every dollar in American healthcare comes from the federal and state governments. And so to not go through the FDA is to not get the benefit of that money.
Right.
And so my sort of argument of like why study these things in the FDA, one, let's understand where they really work and don't. Two, we've got to do that as a precursor if you want folks like Medicaid and Medicare and your commercial insurance to fund them. And that's probably the best long-term way to make these deeply affordable for a broad swath of society. Flip side is, especially in psychiatry, our notion of disease is defined in a handbook called the DSM. And we change the DSM pretty much every year. It changes in radical ways, and I think all you have to do is read every version of the DSM to realize how ridiculous our definition of many of these diseases are.
Yeah, that's true.
This isn't actually a critique of psychiatry. They're doing their best, but we just don't have a great way to define most of these diseases the way that we do for a lot of things like heart disease.
Right.
And the medical system is never going to do a good job supporting folks that don't fit a classic, in the square box definition of a psychiatric condition.
Right.
And that's what we saw at PillPack. And on the one hand, we should invest in those pathways because it can help a lot of people. On the other hand, if that's the only pathway we invest in, there's just a huge number of people that never cleanly fit into those boxes, whether because they don't fit the diagnosis or because they don't want to get care in a really traditional, whitewashed, big H healthcare environment in the US. And I think we should be enabling as many different care pathways as possible for these folks.
Yeah. I think that's really well said. I mean, up in Canada, which is where I'm from, we had the cannabis rollout, and then when psychedelics were kind of coming online, there was this big, I guess we'd call it outcry in our very sorry-making way, in our quiet Canadian outcry way. And the way I like to kind of provide the corollary is that, psychedelics to me are like putting someone behind the wheel of a Ferrari versus a Toyota. Like, you smoke a couple too many joints and you're probably going to make it home. But with psychedelics, there's so much more going on. It's such a deeper and richer experience that I think, some of the people who are on the pro-FDA model are thinking like the power of these things. But I also think from the cultural context, having the rubber stamp, as it were, of like, hey, everybody, it's okay now. It's not the 60s, is really useful, because sometimes people just really undervalue these more statewide initiatives. Unless the big government says it's all okay, then maybe it's not as okay. So I see the value for both happening, both on the societal level of like where culture has got to. Even your friends reading those papers and being like, there actually might be something here. Like maybe we advance this.
That's well said.
Yeah. Thank you. I get a little curious about the pros and cons, though, more on the con side from the statewide level. Like, what does that mean when you're going in to deploy something statewide?
I personally don't think of it as pros and cons, but I do think we need to be realistic about what these products and services are really ultimately designed for in our society.
Right.
The state-based initiatives are never going to have, by definition, the same scientific rigor around how things got tested. They're probably not going to have the same level of regulation around the supply. So, we're not going to be able to say that one dose of psilocybin in the state of Massachusetts looks identical to the dose that you got in Colorado.
Right.
Doesn't mean it's unsafe, but it does mean that if you're an insurance company who wants to pay money, you want to understand that this is exactly the compound that was studied in a clinical trial, and it was done in exactly X, Y, and Z way. And that's
reasonable.
It's super reasonable. Like, we're using, again, if 50 cents of every dollar is coming from our tax money, we're using societal resources to pay for this stuff.
Yeah.
Super reasonable.
Yeah.
But it doesn't mean we shouldn't allow people legal access. For one thing, they're getting it today, and they're getting it in the underground, which is the least regulated version we could possibly imagine.
Totally, 100%.
And as Graham said, we're not actually supporting. It's not like we want these things to be sold on the street corner in a dispensary where you sort of take it and run off into the park by yourself. We want these to be in controlled environments with the appropriate amount of oversight. And so I think in many ways you're getting some of the same safety profile that you do get from the traditional clinical environment. Right. You just don't have the same rigor around the science. And so I don't think it's the right pathway for things like insurance to support.
Yeah. And I mean, to the point of all the papers, and there is, I taught this class one time, innovative thinking, to a group of MBA kids, and I would like to go in there and kind of scramble their eggs or their brains in the beginning, because these are a bunch of quant kids. They don't like qualitative thinking. They want to do the math. And I would say, was mathematics invented or discovered? Like, did you create it, or was it already there and we just kind of figured it out? And I feel so much about that when we talk about like, you know, getting all the data and getting all the support. And when some of these things, like, it's been around, we kind of have a sense of it. So I feel like at the statewide level, that's where those conversations really have a lot of support.
100%.
Statewide, or when I think about the next steps for business, so we have this whole backlog, and we talked a lot this morning about we're not going to have enough psychiatrists, we don't have the clinics, you know, we don't have all this. We have lots of great drug dev coming, but there's this kind of chasm of service care that's going to have to be deployed in the FDA model. But there's a lot of kind of stuff already happening out there at this kind of statewide level. Like you go to Colorado, there's a lot of little businesses popping up here in California and all sorts of places. To look at it with your kind of business entrepreneurial lens, and lots of people in this room thinking like, how can they be involved in a way today? And we'll maybe make this a two-part thing. One would be in supporting these statewide initiatives, like what's needed at the state level to allow people to say, okay, yeah, that makes sense for us to roll it out. And the second part is, as you're seeing it deployed, say in states like Colorado and California, what's not being done in a way that you'd say, hey, like maybe let's consider businesses supporting or growing up in this way in a better way when we've gone from A, B to C, and we've learned a few lessons.
I would say that, so couple comments. First of all, I don't actually know a ton about the exact state of the details in Colorado and Oregon. So I won't comment a ton on what I think is missing or not missing there. But to zoom out for a second, I would say my biggest thing is have patience. These are new businesses. They're going to need a lot of underlying infrastructure that we take for granted. Banks that want to give you bank accounts.
Right.
You know, there are so many new tools, even in the last decade since we started PillPack, to enable new businesses. Things like, you know, Stripe online, things around identity, et cetera, that make building a business today dramatically easier than it was 10 years ago. And that was true 10 years ago compared to the 10 years before that. And many of these businesses have decided not to support even healthcare because they're too worried about it. I suspect they are going to make it harder to start psychedelics businesses.
Right.
That, we shouldn't see that as, oh my God, this is never going to work. We should just see it as, it's just going to take some time. And we should all be patient with that ecosystem coming together. What that means is there's a bunch of areas that are room for investment around creating versions of that infrastructure for the psychedelic community. And so to the extent someone feels like they know a lot about finance, they should go out and start a bank that's for supporting these folks.
Right.
And has a different way of thinking about compliance and a different way of thinking about how to validate the scam artists from the people who are really trying to do some good.
Right.
The bigger thing, though, if you just think, like, what do we really need in this population? The reason I am so interested in these state initiatives is I think the fundamental moment at which you make it possible, that is the main thing that needs to happen. And the reason I think that is the sort of critical, necessary, and also sufficient condition is that the great thing about entrepreneurs is they always figure it out.
Yeah.
And so the only real thing we need is to make it possible. And I think past that, what we need is the entrepreneurial energy to go try. So if you're thinking about starting a business in this space, just go do it. Like, don't wait. Don't think too hard about it. The only thing you need is conviction. And I don't mean to make that sound simple. Conviction is the hardest thing to have when you're starting a company, but that really is the only thing that you need to have. And so I think as long as that is out in the community and we continue to foster and encourage people to have that conviction and to follow that conviction, the rest will solve itself. We could accelerate that by helping build some of the infrastructure for these ecosystems for sure, but entrepreneurs they'll get creative. They'll find ways.
Yeah, they'll figure it out. I mean, I think there's a moment in the early rush of finance into psychedelics a few years ago. Like, I feel a little shameful about it now, but I was excited at the time. Like, we raised $35 million off a slide deck. I didn't even have a team yet. You know, people were just so excited about it. So a lot of people came in, and a lot of people had clinics, and all these things were happening. And then we were just too early. It was just too soon. And then a lot of money went away. And then there's a lot of people who are now showing up going, you know, a bit like when you do double Dutch skipping, and it's like, is it time? Is it now? Should I jump? So we think about the timeline of these things and these statewide initiatives. Like, when is the time? How long do these things take? I mean, this is an impossible question to answer specifically, but it's just the patience thing.
I just think if you're the actual entrepreneur, you gotta be deeply realistic. I mean, this is why I just like follow your customer. You gotta be deeply realistic about who is my customer and do they really exist and are they really gonna pay me money? And I think if you're pragmatic about that,
Yes.
You don't have to worry too much about the macro. Like, I don't think the way to figure this out is to think at a macro level about, ooh, is the ecosystem really ready or not yet?
Yeah.
Just, you have to
There's people hurting.
Yeah, you got to be like feet on the ground of who am I really trying to get to, and what is my business model and business plan to get to them, and are they out there yet?
Yeah.
That's what, if I was the entrepreneur, that's what I'd be thinking. If I'm an investor, then yeah, predicting this timing matters a little bit more, because you're not the one doing it. Every major moment of innovation is a history of people being a little bit too early, a little bit on time, and a little bit too late. So this is the whole point of risk capital.
Yes.
And they should get out there and take on risk. And that is, time is one of the variables of risk that you're taking on. So, there's probably...
How close is Massachusetts, would you say? Like, I don't know if you can say, but...
Honestly, I don't think anybody fully knows, in the sense that it's on the ballot this November.
Okay.
But the state has a lot to do with how that gets implemented. And so I don't think we have a hard and fast understanding at this point of what that exact timeline is going to look like. Mostly we're focused on making sure it passes. Like, that's step one, and the only thing to focus on for now. One of the things I really do love about the environment in Massachusetts is the public health department there will have a lot to do with how it gets implemented. And the physicians and clinical thinkers who run that organization, I think, are exactly the people you want thinking about this kind of stuff. And so it's one of the reasons I am so excited about that particular environment for this. But what that means for timeline, we don't know.
TBD.
Yeah.
I don't have the iPad for the questions, so maybe someone on the AV team or someone on the support team can bring it up to me. If anyone has questions, now would be a great time to submit them. I know that the last group walked away with iPad. Someone's deeply scrambling at the back at the moment, like, where did the iPad go? Here's Patrick. Thank you.
It magically pops up.
And it magically shows up. We have a few minutes for questions, and I know we're heading into lunch. So, this is the one with the pin. We're doing it live. And we're in. And also a reminder for the folks who are thinking about lunch, if you didn't yet order, you're probably going to want to make sure that you already did that, or, find your way around. I'm just making my way to the questions. All right, this feels reasonable. What's your next project? Like, if changing legislation statewide wasn't sufficient, what else are you up to?
I'm really interested in investing, advising, helping build on both sides of this. So I'd love to help entrepreneurs who want to build, therapy centers, clinics, retreat centers. I'd love to help with that if they're using the state-based pathway. And then in the FDA pathway, I think there's a lot of the same types of pickaxe and shovel work that had to enable PillPack. I think we need to see the same thing.
On both sides? On
both sides. This is a really different delivery modality, I think, in ways that people aren't fully appreciating. We don't have an example outside of Spravato of a drug that gets administered by, and even Spravato doesn't quite work this way. Like, we don't have an example of something that gets administered by a therapist. And so currently the obvious thing to do in medicine would be to use the same infrastructure we use for infusion. That's what Spravato tried to do, and it's why their launch was so rough, because the economics aren't the same. The infusion drugs reimburse at such a different level than something like Spravato does that ended up not working. They obviously have figured it out. It's really working as a drug now, and I'm very optimistic that we will figure it out in MDMA and in psilocybin and others. But there's a bunch of infrastructure that's going to need to be built to make that possible.
Yeah, and I get a little bit curious about what infrastructure is going to be built at the state levels, that when the FDA stuff comes in, it kind of piggybacks on all those existing clinics and locations. It's really going to depend on how people approach it.
Maybe. I'm probably pessimistic those things have a lot of overlap.
Okay.
Yeah.
I was trying to be an optimist.
Yeah. I think that's okay, though. Like, I think we want that, actually. I don't think we want them to try to serve. I really think these populations are different, and I think we want these different tools in the world, and the way to get the most value from them is to not make them beholden to each other.
Yeah, and to really differentiate that experience, to your other point. Okay, wrong contacts. Oh, good. It says in Massachusetts, there's also a pilot program moving forward. Legislation will be dropped early next week. Can you say more about that? Do you know anything about that one?
I don't know the details, but I guess what I would say is there are certainly multiple efforts in many of these state environments to make these things, to increase access. And our goal here is increased access. I don't think we actually care deeply about the mechanism by which that happens.
Right.
A ballot initiative is a great way for citizens to raise their hand and vote very specifically on a single issue. But ultimately, it's the outcome we care about here. It's not the mechanism.
Yeah, I mean, based on what I pulled off the net this morning, there's 30-some states who are advancing. Like, that's the lion's share.
It's awesome.
It's awesome.
Yeah.
Okay, well, with that, I think we're going to conclude our session. Any final comments? Any final things you want to say? Anything that feels unsaid about the difference between the two models and where you really feel like the heart of the matter is on advancing at the state level?
You can't go wrong. Just the goal is to be out there and helping build new things that help people. And so whether you do that philanthropically, whether you do it for profit, whether you do it sort of predicated on the state-based models, or you're going to focus on more traditional FDA-like clinics, it really doesn't matter. Like, the point is to be out there and helping people.
Be on the field.
Yeah, be on the field.
Be on the field.
Well said.
Thanks, Elliot.
Thanks, Kelsey.